Absorbed lead is excreted primarily in the urine, so this is 76%, in the feces, 16%, and the remaining 8% is excreted in the hair, sweat, nails, and others. Health effects and toxicity. Clinical presentation of lead toxicity is variable. In children, the obvious symptoms are usually seen at blood levels of 60 microgram per deciliter or higher, with 45 microgram per deciliter as a typical threshold for the acute clinical intervention. So kung titingnan po natin yung ating pong picture, so sa lead, meron pong affectation pagdating po sa IQ. Also, there is the blood affectation causing anemia. Kidneys will also be affected, causing impairment or damage in the kidney. Reproductive organs, this would lead to the decreased sperm count, damaged sperm. Nervous system will also be damaged. With regards to the body, there will be a decreased bone and muscular growth. And sabi ko nga po, pagdating sa brain, affected po yung ating pong lead. So, the lead will produce a reduced IQ. There will be learning disability, behavioral problems, and hearing loss. IQ declines are seen in children with blood levels of 10 microgram deciliter or higher. Other central nervous system symptoms may lead to toxicity. Ito po yung mga symptoms ng ating pong CNS, clumsiness. So affected po pati yung paglalakad niya, sakit sa ulo, behavioral changes, seizure, severe cognitive and behavioral problems may arise kapag nagkaroon po ng lead toxicity ang mga bata. Gastrointestinal symptoms include abdominal pain, constipation, and colic. So with regards to the adults naman, ito naman po yung affected. So it again affects the brain, producing memory loss, lack of concentration, irritability and depression. So the body, again, there will be the fatigue, joint and muscle pain. For the cardiovascular, affected po ang blood pressure. Kidneys will also be affected, same as true dun sa mga bata. Reproductive system, kasama po ng effects niya sa mga children. So there is a decreased sex drive, decreased sperm count, sperm abnormalities. So with regards to the women, kung sila naman po yung affected sa lead toxicity, there will be a spontaneous miscarriage. Also, we have the nervous system kung saan affected po yung numbness and pain on the extremities. Digestive system is also included. So, ito po sa mga adults po na nabanggit kanina, it includes the central nervous system. So, these are the peripheral neuropathies, kidney. Ayan, so chronic renal insufficiency, yung heart natin and yung red blood cells natin. Lead exposure primarily arises in two settings, kagaya na nabanggit po natin, meron sa bata, meron sa mga matatanda. Sa mga bata, this is because, again, sabi natin kanina, mahilig silang maglaro, sa maghawak sa mga bagay-bagay, and so therefore, they might have touched some of the products that contain the lead content. And so, most of the time, ito po yung mga paint chips o yung mga nabakbak na pintura. Ayan, baka po pwede nilang mahawakan yon. Tapos, ayan, pwedeng masingap or pwedeng makain nila. So, that would lead to poisoning. Similarly, sa adults naman po, dahil sa trabaho, the nature of work, ayan, occupational exposure, such as in the smelting, mining, ammunitions, soldering, plumbing, ceramic glazing, and construction industries. For the laboratory evaluation, most common specimen type is a whole venous blood, the result of which is commonly referred to as the blood lead levels o yung tinatawag nilang BLL. This is preferred over the plasma and the serum as the circulating lead is predominantly associated with that of the red blood cells. Elevated lead levels in capillary blood specimen should be confirmed with venous specimen in order to avoid potential contribution to external contamination. urine lead may be useful for detecting recent exposure. Other testing such as aminolevulinic acid, whole blood zinc protoporphyrin, and free erythrocyte protoporphyrin, they are naman useful in screening occupational exposure. So kanina, yung ating urine lead for recent exposure. Ito naman, yung iba't ibang mga test po natin such as the aminolevulinic, whole blood, zinc protoporphyrin, free erythrocyte. So ito naman, screening para sa mga occupational exposure. Non-invasive measurement of the lead in the bone may also be available for radiographic studies. Removal of further lead exposure and parenteral education are essential parts to the management for patients with elevated blood lead levels. So ito po, maganda na bigyan natin ng health teaching yung mga parents, lalong-lalo na syempre, di ba? Kung halimbawa yung paint meron na lead content and so therefore tapos meron pa silang mga bata that is below 6 years old. So napaka-importante po na bigyan po natin ng parental education itong mga parents who have a child that is less than 6 years old. ICP-MS or the inducedly coupled plasma mass spectroscopy is preferred method, although we also have the ICP atomic emission spectroscopy and the graphite furnace are also used in the lead studies. We have also mercury. Half-life, again, nabanggit ko kanina to, ito yung kalahati ng isang substance or kalahati ng isang element or ng isang metal na ma-excrete na sa katawan natin. So, this is the amount of time that it takes for the body to eliminate half of the specific substance. So, this is known as your half-life. The toxic heavy metals such as cadmium, mercury, and lead can accumulate over a lifetime or may have long half-lives. Kaya napaka-importante po na i-determine natin kung ano ang half-life ng bawat elements na meron tayo. We have mercury. Ayan, so nakita naman po natin. So with the picture, alam na po natin na si mercury yan. Mercury is also called quicksilver. It is a heavy silvery metal. Along with bromine, mercury is one of the two elements that are liquid at room temperature and pressure. There are three naturally occurring oxidation states of mercury, namely we have hydrogen 0 or mercury 0, mercury 1 positive, mercury 2 positive. Yan. So ito pong tatlo ang mga oxidation states ng ating pong mercury, namely mercury 0, mercury 1 positive, and mercury 2 positive. Ito po yung mga uses po ng mercury sa atin: dental amalgams, electronic switches, germicides, fungicide, and of course, we have the fluorescent light bulbs. The use of mercury in medicine has greatly declined in all respect. However, mercury compounds are found in some over-the-counter drugs, including topical antiseptic, laxatives, diaper rash ointment, eye drops, and nasal spray. Mercury is also widely used in the production of the eye cosmetics, lalong-lalo na po yung mascara. Now, with regards to absorption, transport, and excretion, ang route, principal route po ng mercury is through inhalation. Primarily, this is elemental mercury vapor, but occasionally as a dimethyl mercury. Ingestion of mercury chloride and mercury-containing foods. These are mostly found in the predatory fish species. Also, we have cutaneous absorption. So, lalo na, kapag halimbawa nabasag yung mga thermometer, noong unang panahon, tapos nahawakan natin, pinaglalaruan po natin yung mercury. So, this would lead to the route of exposure na papasok sa atin yung mercury. So, specifically, the methyl mercury, which may pass through the skin and even through the latex gloves. Injection of relatively inert liquid mercury and mercury-containing tattoo pigments. Ayan, so pwede pong mabigyan tayo ng mercury. Dental amalgams. So these are inhaled mercury vapor that is retained in the lungs to about 80%. Whereas the liquid metallic mercury passes through the gastrointestinal tract and are largely unabsorbed. So saan madalas po na nagsistay at nagre-retain ng ating pong mercury? Sa lungs. Ayan. 80% po ng mercury po natin is nagsistay po sila sa ating pong baga o sa ating pong lungs. Yeah? Pagdating naman po sa gastrointestinal system, hindi niya na-absorb. So hindi doon ang site of absorption ng ating pong GIT. So usually po sa GIT, this remains unabsorbed. Whereas doon po sa lungs po natin, mas marami po yung absorption ng mercury. So in here, we have the mercury enters the food chain primarily by volcanic activity and man-made sources such as coal, combustion, and smelting. Ayan. So kung titingnan po natin ang drawing po natin, ayan po niya. So we have the anthropogenic mercury. Ayan. So kung saan nakuha po natin yan sa mga industries, ayan, local and regional deposition will then occur. Ayan. So, atmospheric mercury, kung saan madedeposit po sila, ayan, mahuhulog po sila, ayan, sa ating pong tubig, ne? Tapos, syempre, magkakaroon ng methylated mercury dito po sa water system po natin. Global deposition, mahuhulog po yung mercury sa ating pong soil, sa land po natin. And then, also, remitted anthropogenic and natural mercury kasi po, syempre, mag-evaporate yan, mag-undergo ng evaporation, condensation, precipitation, ayan. So, babalik ulit, iikot ulit yung distribution ng mercury po sa atin. Yeah? So, from the volcanic activity to the anthropogenic mercury activity, and then, babalik ulit sa atin. So, the cycle continues. Most of the dietary intake comes from the consumption of meat and the fish products, and estimates of dietary intake varying based on geographic location. Ayan, kagaya dito, syempre, kung malapit po yung ating pong volcano dito sa lake, ganun din malapit sa yung ating industrial company dito sa lake, then pwede po tayong mahawa or mabigyan kasi nga contaminated yung water. Therefore, pati po yung mga fish na nandyan, okay, o yung mga domesticated animals na nandyan, pwede po tayong mahawa sa kanila. The kidney is the major storage organ after elemental or inorganic mercury exposure. Methyl mercury is efficiently absorbed from the gastrointestinal tract, and distribution to tissues, including the brain, appears to complete in 48 hours. Movement of mercury across the blood-brain barrier appears to be dependent on coupling with amino acid cysteine. So, dito po sinasabi na pwede pong mag-pass sa brain yung ating pong mercury kapag nakapag-bound siya sa cysteine. Ayan, yeah. Movement of the methyl mercury across the blood-brain barrier may be dependent when it was able to, bound, to cysteine. Half-lives of mercury, they vary according to the route of exposure and the form of mercury. So, pwede po ang half-life po nito, pwede siyang 5 days in the blood para sa phenylmercury. Pwede rin po itong 90 days in the urine para sa chronic exposure to inorganic mercury. Normally, the highest concentration of mercury is found in the kidney, liver, spleen, and brain. Mercury can also accumulate in the pituitary and the thyroid gland and the pancreas, and also in the reproductive organs. The bulk of mercury accumulated in the body is eliminated at approximately 60 days. Okay, so again, the bulk of mercury accumulated in the body is supposed to be eliminated at approximately 60 days. Ne? So ang tagal bago po ito tuluyang ma-eliminate sa katawan natin. However, organic forms of mercury can accumulate in the brain and may take several years to be eliminated. So, ganyan naman katagal, lalong-lalo na kapag nakaakyat pa ito sa brain natin. Fecal and urinary excretion are the main elimination routes for the inorganic and organic mercury. So, what we see here in the picture is the thimerosal. Ayan. So, ano ba ang health effect and toxicity na related dito sa ating pong product which is known as your thimerosal? So, alam natin na ang mercury, wala po siyang health effect sa atin. Toxicities have been observed following the inhalation, ingestion, and dermal absorption of the compounds. Kagaya ng nasabi ko, ito po, noong unang panahon, yung mga thermometer natin, meron silang mercury, and so pwede pala tayong magkaroon ng toxicity upon the dermal contact o yung paghawak po with our skin nung time na yung thermometer natin are made up of mercury. Mercurial salts were historically used as diuretics, topical disinfectants, and lactasives before mercury toxicity was well understood. Ayan. So, historically, ginagamit po sila para pampaihi. Ganun din po yung mga important uses kasi ng mga diuretics po natin, pampababa din ng presyon. So, it also is being used as a topical disinfectant and laxatives. So, ito po mga laxatives na to, pampatain naman sila. So, doon pa pala pwede na magkaroon ng mercury toxicity. Since the 1930s, some vaccines contain the preservative thimerosal. So, ito na po yung ating pong nasa picture. Okay? A mercury-containing compound that is metabolized into ethyl mercury. So, ito daw yung madalas na ginagamit po natin na preservative pagdating po sa ating pong mga vaccines. Although it was widely speculated that this mercury-based preservative can cause or trigger autism in children, scientific studies showed no evidence supporting any such link. Ayan. So, it was linked or it was stated na ito daw ang isa sa mga causes kung bakit nagkaroon ng autism. Siyempre, noon ang mga medications, kagaya ng nasabi po natin, mga vaccines, ginagamitan po ng preservatives such as thimerosal. So, probably, the scientists, naisip nila na pwede kaya nagkaroon ng autism yung ibang mga bata ay dahil dito. Pero sabi nga, hindi siya proven. There is no such evidence to support of the link. Nevertheless, thimerosal has been removed or reduced to trace amounts in all U.S. vaccines and recommended for children 6 years old or younger, with the exception of the inactivated influenza vaccine. So dito, dahil nga sa nabalita tungkol sa effects ng mercury, inalis ito, okay, as a preservative sa mga vaccine natin. And yung iba naman po, binawasan yung content po nila. Other organic mercury and elemental mercury vapor are toxic to both the central and the peripheral nervous system. Mercury attacks the central nervous system before the victim shows the symptoms. So, yan wag nating kalimutan na ito po yung ating pong mercury ang affectation niya yung central nervous system at yun nga before it will manifest the signs and symptoms that were stated previously, pwede na po siyang umakyat sa ating pong CNS. It will affect the central nervous system. So, what we see here in the picture, we have the health effects of mercury. Nabanggit natin kanina. Central nervous system, ayan, affected po ang CNS po natin o ang central nervous system. It also impairs hearing, speech, vision, and gait o yung paglalakad. It also causes involuntary muscle movements. It also corrodes with the skin and the mucous membrane and causes chewing and swallowing difficulties. Elemental mercury readily vaporizes, and its inhalation can produce harmful effects, specifically in the nervous system, in the digestive tract, in the immune system, and the lungs, and in the kidney. Inorganic salts naman can affect the eyes, the skin, the gastrointestinal tract, and the kidneys. So palagi po nandyan ang kidney po natin, nenak. The toxicity of mercury is primarily through the reaction with that of the protyl sulfhydrine groups o yung MSH. Again, ang toxicity is because of the reaction with that of the protein sulfhydryl group or yung MSH, resulting in dysfunction and inactivation. Liquid elemental mercury is poorly absorbed and relatively non-toxic, but the elemental mercury vapor is highly absorbed and is highly toxic. The inorganic ionized forms of mercury also are toxic. Further bioconversion to an alkyl mercury, such as we have here your methyl mercury, yields to a very toxic species of mercury that is highly selective for lipid-rich medium such as the brain. Again, sabi po natin, ang mercury po parang naa-attract siya doon sa brain natin. Kaya umaakyat siya kaagad sa brain natin. So, sabi nga po dito, sa nabanggit dito sa bullet na to, na the methyl mercury is very toxic and it is highly selective o gustong-gusto po niyang pumunta doon sa ating pong lipid-rich medium which is our brain. So we have the mercury intoxication that can manifest in many signs and symptoms, may affect several organs. So this also includes signs and symptoms such as headache, ayan, so CNS na naman po ito o pagdating po sa ulo, tremor, impaired coordination, abdominal cramp, diarrhea, dermatitis, polyneuropathy, proteinuria, and hepatic dysfunction. Because of many of these are relatively non-specific signs and symptoms, the laboratory testing is a key role in assessing mercury intoxication. Kung nakita po natin ang mga signs and symptoms na pinakita dito sa mercury natin, mga anak, such as headache, tremor, impaired coordination, marami din. Di ba, nak? Marami din pong mga sakit kung baga pare-pareho na pwede nilang ma-feel or ma-experience yung headache, tremor, impaired coordination, diarrhea. Ang dami din po mga sakit kung saan yan din po yung signs and symptoms na nararamdaman nila. Kaya ano po ang ating pong i-advise? So, kailangan talaga magpa-assess ng mercury intoxication para masigurado po natin na ang mga signs and symptoms na nararamdaman natin is related to the poison, and that is your mercury. Ayan, kasi nga po, pare-pareho. Itong mga signs and symptoms na to, hindi sila clearly stated. Kasi halos general po yung mga minamanifest na signs and symptoms. Kaya nga napaka-importante po na magpa-test tayo, di ba? That we have a mercury testing. Okay, papatest po natin ang ating pong ang dugo, okay, ang ating pong urine sa laboratory for further analysis. So, mercury is usually determined as a total mercury level in the blood and in the urine without regards to chemical form. Now, analytical methods include ICP mass spectroscopy and cold vapor atomic absorption spectroscopy. Some of the important reminders for our activity, we are going to have practice test. Okay, so yung pong practice test po natin is a multiple choice type of test with 2 attempts. Ayan. So, should you have any questions or clarification, you may message me here. So, sa Canvas po, pwede po kayo mag-message sa akin directly. Here is my email address. Thank you so much and God bless you.